Welcome, everyone, to this in-depth exploration of Ozempic, a medication revolutionizing the management of type 2 diabetes. In this extensive guide, we'll delve into every aspect of Ozempic, from its basic definition to its intricate workings, benefits, clinical evidence, potential side effects, and common product variations. So let's embark on this enlightening journey to uncover the secrets of Ozempic and its role in diabetes care. What is Ozempic? Let's start with the basics. Ozempic is a medication primarily prescribed to individuals diagnosed with type 2 diabetes. Belonging to the class of drugs known as GLP-1 receptor agonists, Ozempic acts by mimicking the effects of a crucial hormone called GLP-1, glucagon-like peptide 1. This hormone plays a pivotal role in regulating blood sugar levels, insulin secretion, and appetite control within the body. How does Ozempic work? Ozempic operates as a potent ally in the battle against type 2 diabetes by leveraging the body's natural physiological processes. At its core, Ozempic belongs to a class of medications known as GLP-1 receptor agonists, which emulate the actions of a crucial hormone called GLP-1, or glucagon-like peptide 1. Upon administration, Ozempic sets in motion a cascade of events within the body, orchestrated primarily through its interactions with specialized receptors known as GLP-1 receptors. These receptors are predominantly found in pancreatic cells, particularly in areas responsible for insulin production and secretion. Activation of GLP-1 receptors by Ozempic triggers a series of orchestrated responses aimed at regulating blood sugar levels and enhancing overall metabolic function. One of the primary effects of Ozempic is its ability to stimulate the secretion of insulin from pancreatic beta cells. Insulin serves as the body's primary regulator of glucose metabolism, facilitating the uptake of glucose into cells and thereby reducing blood sugar levels in the bloodstream. Furthermore, Ozempic exerts a significant influence on gastric function, particularly in the context of meal digestion and nutrient absorption. By slowing down the rate at which food moves through the stomach and into the intestines, Ozempic helps to attenuate the postprandial rise in blood sugar levels, thereby promoting greater glycemic stability throughout the day. This delayed gastric emptying also contributes to feelings of fullness and satiety, which can aid in appetite control and weight management, a critical aspect of diabetes care. Moreover, Ozempic exerts additional beneficial effects beyond its direct impact on blood sugar regulation. It has been shown to modulate the secretion of glucagon, a hormone that works in opposition to insulin, thereby further contributing to glycemic control. Additionally, Ozempic can enhance the sensitivity of peripheral tissues to insulin, allowing for more efficient utilization of glucose by cells throughout the body. Furthermore, Ozempic has demonstrated the ability to preserve pancreatic beta cell function, a vital aspect of long-term diabetes management. By preserving the function of these insulin-producing cells, Ozempic helps to sustain endogenous insulin production and secretion, thereby maintaining glycemic control over time. Benefits of Ozempic. The benefits of Ozempic extend far beyond blood sugar control. Numerous clinical studies have demonstrated its efficacy in improving glycemic control, as evidenced by reductions in A1C levels, a key marker of long-term blood sugar management. Moreover, many individuals experience weight loss while on Ozempic, a welcomed effect that not only aids in diabetes management, but also contributes to overall health and well-being. Additionally, Ozempic has shown promise in reducing the risk of cardiovascular events, such as heart attacks and strokes, making it a valuable asset in comprehensive diabetes care. Clinical studies and efficacy. Let's delve into the scientific evidence supporting the use of Ozempic in type 2 diabetes management. Over the years, numerous clinical trials have evaluated the efficacy and safety of Ozempic in diverse patient populations. These studies consistently demonstrate the medication's ability to improve glycemic control, with significant reductions in A1C levels observed across various dosages and treatment durations. Furthermore, Ozempic has been associated with improvements in cardiovascular outcomes, including reductions in the risk of heart attack, stroke, and cardiovascular-related mortality. Such findings underscore the pivotal role of Ozempic in not only managing diabetes, but also mitigating its associated risks. Side effects of Ozempic. While Ozempic offers substantial benefits, it's essential to be aware of potential side effects. Like all medications, Ozempic may cause adverse reactions in some individuals. Common side effects include gastrointestinal symptoms such as nausea, diarrhea, and vomiting, particularly during the initial stages of treatment. However, these side effects often diminish over time as the body adjusts to the medication. In rare cases, more severe side effects, such as pancreatitis or allergic reactions, may occur and require immediate medical attention. Therefore, it's crucial to monitor for any unusual symptoms and consult healthcare professionals promptly if concerns arise. Common Ozempic products. Ozempic is available in various formulations to accommodate individual needs and preferences. The most common form is a pre-filled injection pen, which contains a specific dosage of Ozempic suitable for subcutaneous administration. These pens offer convenience and ease of use, allowing individuals to administer their medication confidently and accurately. Additionally, Ozempic is available in different strengths, enabling healthcare providers to tailor treatment regimens to each patient's unique requirements and medical history. In conclusion, Ozempic stands as a cornerstone in the management of type 2 diabetes, offering a multifaceted approach to glycemic control and overall health improvement. Its ability to mimic the effects of GLP-1, coupled with its proven efficacy and safety profile, makes it a valuable asset in diabetes care. However, it's essential to weigh the benefits against potential risks and collaborate closely with healthcare providers to optimize treatment outcomes. By leveraging the power of Ozempic alongside lifestyle modifications, individuals with type 2 diabetes can embark on a journey towards better health and well-being. Ready to optimize your medical care and enhance your well-being? Subscribe to MedHeal 101 for expert insights and stay updated on the latest in healthcare advancements. If you found this video informative, give it a thumbs up and share it with your friends. Thanks for watching, and remember to prioritize your health. It's the ultimate investment in yourself. See you in the next video.